When your teeth are not completely straight, what are some things that can happen? And you might have noticed some of these things yourself. Things such as plaque and food being trapped around the teeth. What they do is it increases the amount of inflammation that are around your gums. What some of my patients will always notice is that when they're flossing or brushing, that the area that's around the crooked teeth tends to bleed more. Now, what causes this? When teeth are not completely aligned and they're overlapping, this causes an area which traps not only food, but plaque as well. This can cause bleeding of the gums and loss of bone around those teeth if not treated over a period of time. So as you can see in this case here, we've got some crowding of these lower teeth. Around the areas here, the gums are quite puffy and we can see some areas where food and plaque are being trapped. This is exactly what I was talking about when I was saying that having non-aligned teeth can act as a plaque trap. So if you've ever noticed the area around some crooked teeth is bleeding more, make sure that you go and see your dentist and get a checkup just to make sure that there hasn't been any permanent damage. So how do we fix this? One of the advantages of having very straight teeth is that it's much easier for you to maintain those areas. Plaque and food tend not to get trapped around those areas. And so for long-term gum and bone health around those teeth, having a very straight or aligned smile is not only just for the looks, but it's also for the health of your gums and the bones around it. Another consequence of not having completely straight teeth is that there's often uneven wear on the teeth because of the bite. If teeth are not aligned, they can sometimes stick higher or lower in the bite, and over the years, these teeth can prematurely wear. What we often find is when we straighten all the teeth, there is some variation between the heights of those teeth because of this uneven wear. So having straight teeth prevents this premature wear. But don't worry, if we do need to align your teeth, afterwards, there are always restorative options that we can use to fix up the edges of those teeth to give you back what you had there before. So in summary, having straight teeth not only helps the gums and the bones around the teeth, it can also prevent premature wear of some of those back and front teeth as well. So it's important that you consult with your dentist and find a treatment plan that's right for you.